and I think we'll begin. So just as an introduction, I guess I can do the slides myself. This is a postgraduate course on inflammatory bowel disease. So my assumption here is that most of the people have patients who are in this room now have patients who have inflammatory bowel disease. It's been a very interesting life for me with inflammatory bowel disease because this disease was described at the institution where I work. This is a copy of the original paper published in 1932 in the American Medical Journal, American Medical Association Journal, with the three authors as you see. Those three authors were listed alphabetically. There was, I mean, I'm not old enough to have been there during this time, but there are a lot of stories that float around about how it got listed like this and who really described it. But that's the way the Board of Trustees decided that the article was going to be listed. I can tell you that Dr. Oppenheimer was a urology resident rotating through pathology who just got his name on the paper. Really had nothing to do with the disease at all. But Dr. Ginsberg and Crohn were the two big players at that time. Ginsberg was still operating when I was an intern in first-year resident. And I can tell you that this is, when you went into the operating room, if you called it Crohn's disease, he kicked you out of the operating room. Because for him, it was always Ginsberg's disease. In fact, he was the one who recognized that there was something going on that was different than what they usually saw at that point in time. But the way that the politics worked at that time, that's the way it came. This is a picture of these three gentlemen. On the left was Oppenheimer, in the middle is Crohn, on the right is Ginsberg. It's one of the, not very many pictures of them together because there was a little animosity that was generated with this. No one had any idea that it would be labeled Crohn's disease. It was obviously, it was regional enteritis at the time. But when it became very well known, there was, I don't want to say love loss, but there wasn't a lot of love loss anyway. And this is one of the few pictures. This is, I think, actually on Crohn his 90th birthday, and they all sort of got together. Neither of them are alive now. But inflammatory bowel disease has been part of my life since I did my training as an attending, and it's continued in the realm of laparoscopic surgery, and that's one of the really exciting things that has happened in complex GI laparoscopy. Is that we are now able to offer this technology to some patients who are going to need multiple operations. Scarring is a real issue. As you know, you'll hear from our medical friends who are going to talk about it, the medical aspects. There's a bimodal distribution in terms of age, so there's a lot of young patients who really care about the body image and things like that. So it's been really a boon.